Hi, I'm Dr. John Jane from Santa Monica Fertility, and today I'd like to talk to you about tubal factor infertility. So this is infertility related to the fallopian tubes. The fallopian tubes are actually very important for fertility. The fallopian tube picks up the egg from the ovary. It's in the fallopian tube that the egg is actually fertilized by sperm, and it's in the fallopian tube that the embryo grows for the first 3 days of development. So it nourishes the embryo and helps transport it to the uterus. If the tube is damaged or blocked, we see infertility and also an increased risk of ectopic pregnancies. Ectopic pregnancies are pregnancies where the embryo gets stuck in the fallopian tube. The most common causes for blocked tubes or tubal factor infertility are sexually transmitted diseases such as gonorrhea and chlamydia, pelvic surgeries, ones that especially involve having fibroids removed or ovarian cysts, and a condition called endometriosis. Women who have these risk factors should actually consider having their tubes evaluated using a procedure called an HSG, or hysterosalpingogram. In this procedure, a catheter is placed into the cervix and a small balloon is inflated, after which X-ray dye is pushed through the uterus and the fallopian tubes. We then look on the X-rays to make sure the uterine cavity is normal and that the tubes are open. If the tubes are actually scarred or blocked, surgery can help in some cases, but most of the time it does not help. We have to revert, in fact, to in vitro fertilization. So with in vitro fertilization, or IVF, we actually harvest eggs directly from the ovary, fertilize the eggs in the laboratory, and then place the embryos directly back into the uterine cavity, this way avoiding the use of the fallopian tubes. However, it should be noted that if the tube is blocked at its end and filled with fluid, we call that hydrosalpinx, it has to be removed before in vitro fertilization is performed. And the reason is that fluid in the fallopian tube can leak back into the uterine cavity and destroy embryos. So for patients out there who are infertile and who have risk factors for tubal disease, it's very important to assess the fallopian tubes early in the process of care. If you have any further questions about tubal factor infertility, please contact me at info@santamonicafertility.com. Thank you.